Good day, everyone. I am Sandra Malonzo, together with Moira Ronquillo, here to discuss the seventh chapter from Peter Singer's Practical Ethics entitled Taking Life with Regards to Humans. Before we start, gusto sana namin magbigay ng trigger warning dahil yung mga topics ang pag-uusapan natin o kaya mention ay tungkol sa euthanasia, abortion, suicide, and acts of killing. Let's now know more about euthanasia. It refers to a gentle and easy death according to the dictionary. It also means killing of those who are incurably ill and in great pain or distress to spare them from further suffering or distress. One form of euthanasia is physician-assisted suicide. Based on the name, we can gather na yung physician nag-a-assist siya upon the behest of the patient na gusto na magpakamatay. So the physician's job is to prescribe medication para tulungan na ma-ease into the patient's death yung patient. Now, let's learn more about the three forms of euthanasia. Merong voluntary, involuntary, and non-voluntary. So, dito, important na i-take into consider natin yung capacity to give consent ng patient or ng subject and kung anong type of consent yung binibigay nila. So, for example, sa voluntary euthanasia, merong capacity na magbigay ng consent to die yung person. Dito naman, it doesn't matter kung yung person ay wala na siya sa magandang kalagayan ngayon. Ang required lamang ay ibigay niya sana yung consent niya to die nung okay pa siya. On the other hand, yung involuntary naman, meron siyang capacity to give consent, pero yung consent na binibigay niya ay para mabuhay. So in other words, ayaw niya pang mamatay. Ngayon, meron kasi times na kahit na nagbigay na ng consent to live or pinili pa rin mabuhay ng tao, ay some people still go against this. Kaya tinawag rin na against their consent yung involuntary euthanasia. Lastly, we have non-voluntary euthanasia. Kung makikita natin, walang boxes na naka-check, di ba? Dahil yung non-voluntary, pwede rin siyang tawagin na without their consent. Dito, wala ng ability to give their consent na mabuhay or magpakamatay dahil yung mga subjects dito ay maaaring dahil incurable na yung sakit niya o kaya naman hindi siya makapag-isip ng tama dala ng old age or ng iba pang accident. Yung non-voluntary euthanasia, pwede rin natin siyang tawagin na without their consent. So before moving on, I would like to emphasize na yung next slides, we will tackle more about non-voluntary euthanasia na kung saan yung isang form nito ay yung abortion. Para naman makarelate tayo somehow sa topic, let's see kung ano nga ba yung state or yung stance natin sa abortion dito sa Pilipinas. So, in the Philippines, abortion is illegal on all counts. Kahit na yung dala mo ngayon ay product ng rape or ng isang incest na relationship, hindi ka pwedeng pa-abort. Kahit na harmful yan sa nanay o sa nagdadala ng bata, hindi pa rin pwedeng magpa-abort. Even if you know that the child has a disability, a severe one, or alam mo na malapit na siyang mamatay, or mamamatay siya kapanganak mo, hindi mo pa rin pwedeng ipa-abort yung bata. Now, physicians and midwives who perform abortions can also be jailed here. As a result, yung mga Filipinas, they either keep the child kahit na high risk yung pregnancy, o kaya naman nagre-resort sila sa unsafe abortion, lalo po nagpapa-endanger dun sa health ng mga Filipinas. And another thing about abortion in the Philippines is that women are stigmatized and discriminated when seeking abortion. Worst is kahit nasa clinic ka pa pumunta or sa mga nurses, hospitals, doctors, madalas ay discriminate pa rin daw yung mga nanay na magpapa-abort. And lastly, solid pa rin yung law natin sa abortion dahil we follow the church's orders na ayun nga, dapat daw i-maintain daw yung life because every life is sacred. Based on my research, yung Philippines lang ata yung alam ko na solid yung abortion law kasi in other countries, yung law nila sa abortion ay selective. Merong mga cases na tanggap siya, pero namang mga cases na hindi siya tanggap. So now that we know how abortion is in the Philippines, how solid we are against it, tingnan naman natin yung mga arguments ni Peter Singer kung paano pwede maging justifiable yung abortion. So according to Singer, killing a disabled infant is not morally equivalent to killing a person. Would you agree? And oftentimes daw, it is not wrong at all to kill a disabled infant. Malalaman natin yung reasons sa next slides. Peter's first argument is that infants don't really have a right to life. So when we say a right to life, yung mga infants daw hindi sila self-aware. Hindi ko nila alam na nag-exist sila. Kaya okay lang daw na i-erase sila from this world. At kahit daw na meron silang potential to develop self-awareness, ang dapat daw natin i-consider is yung right now. Kaya daw justifiable pa na ipa-abort yung mga bata, lalo na kung wala pa silang right to life o hindi pa nila alam na nag-exist sila sa mundong ito. Next argument naman ni Singer ay yung attitude ng ating parents. Meron daw cases na kahit na alam natin or alam ng mga magulang na yung anak nila ay mayroong disability, aalagaan pa rin nila ng bonggang-bongga. Although meron namang cases na kapag nalaman nila na mayroong disability yung anak nila, ayaw na nilang i-push through yung pregnancy. Ngayon, ang question daw ay, paano kung yung anak mo ay mayroong severe disability? Okay ba na ipa-abort siya or hindi? So ngayon, kailangan daw natin i-consider na kapag yung bata mayroon siyang severe disability, yung life niya ay para bang it's not worth living anymore. So if that's the case, it's not worth living anymore. Tapos yung parents, hindi pa sila supportive or wala silang masyadong concern doon sa anak or hindi sila interested na pangalagaan yung anak na may disability, it is justifiable daw to get an abortion. Ngayon, what if naman daw yung bata, mild lang daw yung disability niya. So it means na yung life niya, it is still worth living. Meron pa namang possibility na maginhawa yung buhay niya. Pero yung parent, ayaw niya or hindi pa rin siya concerned dun sa anak or wala pa rin siyang interest sa pangangalaga dun sa anak niya na mayroong disability. Is abortion still justifiable or not? The answer is yes and no, depende dun sa perspective. Kapag ginamit natin yung prior existence view of utilitarianism, the answer is no. This view is concerned with the existence of a being prior to making a decision. So in this case, that is the infant. And since we're talking about utilitarianism, yung gusto natin makuha dito ay yung ultimate pleasure or yung happiness. So, sa case na ito, kapag kinuha natin yung pleasure ng infant, which is yung pamumuhay niya, kahit na hindi gaano maginhawa yung pamumuhay niya, since we're also talking about utilitarianism, concerned tayo doon sa happiness na makukuha ng isang being. So, if we abort this child, we are taking away its chances of living a happy life kahit na meron siyang disability. So, that makes abortion not justifiable sa scenario o sa perspective na ito. Dito naman sa yes, ang situation ay paano daw kung i-abort natin yung disabled child? Tapos, try natin mag-produce ng bata na normal. Hindi ba nun yun mas okay or mas pleasurable dahil better nun yung life na i-lead ng normal na child? So, this perspective is the total view of utilitarianism, kung saan concerned sila sa pag-increase ng pleasure ng isang being na existing or increase in the number of beings who exist. Dito naman sa perspective na to, what matters is yung total happiness na makukuha natin. Since mas mataas yung happiness or yung pleasure na makukuha ng bata na normal kapag nag-lead siya ng life niya without complications, mas pipiliin natin yung option na iyon. Kaya okay lang na ipa-abort yung bata na mayroong disability. In exchange naman, makapanganak yung bata na normal. In other words, abortion is justifiable when the gain of a better life for the normal child when the disabled one is erased outweighs the loss of the life of the aborted disabled child. So in other words then, abortion is justifiable due to replaceability. So kung mapapansin ninyo yung disabled child, para bang pinalitan lang natin siya ng normal child. So palit-palit lang sila, which makes the children replaceable, which is bad rin kung titinan natin. And agree din dito yung mga disability advocates na it's bad since they are against the replaceability argument because it implies that the life of those disabled is less worth living. But this is not true naman daw. Yung example na binigay sa book ay yung thalidomide case. Isa siyang drug na binibigay as a tranquilizer or medication for colds, flu, and morning sickness ng pregnant women. However, meron pala itong unintended consequence sa mga anak ng pregnant women. Like the picture, yung mga bata, kulang sila ng limbs or wala silang limbs at all. Ngayon, the argument here is that kung hindi daw natin pinapahalagahan yung mga disabled persons, bakit natin ipaglalaban na ipaban sana yung thalidomide, which naban nga, lalo na sa mga pregnant women, para mabawasan na yung mga chances na magkaroon ng anak na merong abnormalities like this one, kulang yung paa or yung kamay nila. Kung kanina nung pag-usapan natin yung effects ng abortion doon sa infant, pag-usapan naman natin ngayon yung effects nito sa iba. So for parents or moms, carrying a child only to abort them later can be heartbreaking, which is why ang dami sa mga babae ay pumipili ng prenatal diagnosis followed by an abortion. Kasi may kita natin yung condition ng mga bata. Kung meron ba silang disabilities habang nasa tiyan pa lang sila or before birth. And afterwards, meron kakaroon sila ng choice na i-abort yung bata o sa laman nila na merong disability. Pinipili ito ng women over live birth with the possibility of infanticide. Pero kung yung latter daw na choice ay hindi daw morally worse than the first one, so dami daw sa women ang pipili na itutuloy nila yung pregnancy, tapos kapag pinanganak nila, doon na lang nila ipapapatay yung bata. Once na nalaman nila na meron siyang disability. In the case naman na nag-adopt ng isang disabled na child ang isang pamilya or isang parent, para bang nawawala yung pagiging argument ng replaceability na maging justifiable yung abortion or infanticide dahil walang replacement na naganap. Yung biological mother ay nanganak ng Mormon na bata na kung saan meron siyang better life. However, buhay pa rin yung anak niya na disabled pero nasa adoptive family na lang. Kaya walang replacement na naganap. Pero nasa adoptive family na lang. Kaya para bang walang replacement na nangyari. In other cases, paano naman daw yung mga people in a persistent vegetative state? Kapag sinabi natin ito, para bang wala na silang awareness o hindi na sila conscious sa mga bagay-bagay. Sa example dito, yung mga comatose. So it's possible for them to still have awareness kahit konting lang. But once it's clear that they have no awareness and can never have again, their life has no intrinsic value. Kaya okay lang na i-take na yung life nila. Meron rin daw times na yung other old people, nakikita nila na nagpo-perform ng non-voluntary euthanasia yung authorities sa iba pang old people. Tapos para bang ito-trauma sila or na-internalize nila na lahat na lang ng injection or na tablet na ibibigay sa kanila ay lethal rin or makakapatay sa kanila. So, ang isang solution na pinropose ni Singer dito ay allow people to register their refusal to be subjected to non-voluntary euthanasia under any circumstances. Lalo na kapag nasa in good health pa sila kasi kapag matanda na tayo, usually nawawala na or bumababa na yung comprehension natin because of old age or other illnesses. Yung para bang nakuha ko dito ay yung pag kumuha tayo ng driver's license tapos itatanong nila kung willing ba tayong maging organ donor. Parang ganun yung naiisip ko na way dito sa sinuggest ni Singer. Lastly, kahit na ang dami natin pinag-usapan na conditions kanina, especially about non-voluntary euthanasia, sabi ni Singer na it really boils down to the perspective that we want to go with, whether prior existence version of utilitarianism or the total view of utilitarianism. So that's it for my part. Let's now hear about the justification of voluntary euthanasia from Moyer.
So from Sandra, we have seen that it is possible to justify ending the life of a human being who lacks the capacity to consent. In the following sections, we will see in what way the ethical issues are different when the individual is capable of consenting and does consent. So Singer begins the section justifying voluntary euthanasia with the four grounds on which killing a being with a sense of their own future is a more serious matter than killing a merely conscious being could be argued. Classical utilitarianism suggests that since self-aware beings are capable of fearing their own death, killing them has worse effects on other people because they may fear their own death, thus not contributing to society's overall experienced happiness. Preference utilitarianism calculation that counts the victim's desire to go on living as an important reason against killing, which, if violated, does not further the preferences of those affected. Theory of rights that states that in order to have a right to life, one must be able to desire one's own continued existence. And respect for autonomy that states that we should allow rational agents to live their own lives according to their own autonomous decisions, free from coercion or interference. Now, what happens if a person suffering from a painful and incurable disease wishes to die? In classical utilitarianism, Singer argues that people killed under these conditions would have no tendency to spread fear or insecurity, because if one does not wish to be killed, they simply do not consent. In preference utilitarianism, on the other hand, Singer argues that just as preference utilitarianism must count a desire to go on living as a reason against killing, so it must also count a desire to die as a reason for killing. Third, in the theory of rights, according to Singer, to say that an individual has a right to life is not to say that it would be wrong for the doctor to end their life if they choose to waive their right to life. And lastly, respect for autonomy leads Singer to argue that if rational agents should autonomously choose to die, then respect for autonomy will lead us to assist them to do as they choose. So, although there are reasons for thinking that killing a self-aware being is normally worse than killing any other kind of being, in the special case of voluntary euthanasia, most of these reasons count for euthanasia rather than against it. We move on to the arguments of the opponents of the legalization of voluntary euthanasia. Their first argument or arguments raises concern about the pressure that patients may experience from relatives to end their lives quickly, the possibility of the occurrence of murder in the guise of requested euthanasia, and the possible irrationality in the decisions of a sick patient. In response, Singer argues that the Dutch Parliament, they did not legalize euthanasia until 2002, which involved almost 2 decades of carefully developing guidelines to ensure that doctors would not be prosecuted for carrying out euthanasia. So, yun nga, in the Netherlands, euthanasia is only lawful under the following conditions. Sabi ni Singer, these guidelines make murder in the guise of euthanasia very difficult to carry out. The next nations to legalize euthanasia were Belgium and Luxembourg, which are neighbors of the Netherlands. So, pati yung laws nila, they are similar to the Dutch law. So, sabi ni Singer, it is implausible that these countries would have legalized euthanasia if there were clear evidence of serious abuses in the Netherlands. At present, these are the other countries where involuntary euthanasia has been legalized: Colombia, Canada, Spain, and New Zealand. So second, the opposition argued that doctors can be mistaken in their judgment of patients' recovery. Singer answered by saying that a longer life is not such a supreme good that it outweighs all other considerations. The possibility that 2 doctors may make a mistake means that the person who opts for euthanasia is deciding dun sa balance of probabilities. So they are willing to give up an extremely small chance of survival in order to avoid suffering that is overwhelmingly likely to end in death. Opponents also argued that improved care for the terminally ill has eliminated pain and made voluntary euthanasia unnecessary. Pero sabi ni Singer, but it is not only physical pain that makes people wish to die. Take, for example, Diane, a patient who had a severe form of leukemia. She valued maintaining control of self and dignity in the time she had left. This would no longer be possible because preoccupation with her fear of lingering death would interfere sa kanyang nalalabing time, with getting the most out of her time. So she wanted to die. Another example is Betty Rowland's mother, a patient with ovarian cancer that spread to other parts of her body. She can no longer be treated. There's no more treatment. So parang naghihintay na lang siya ng death niya. Sabi niya, she is experiencing nothing but nausea and pain. And isa rin sa statements niya is yung, who does it benefit if I die slowly? Ayun. Ngayon naman, what about the advocates for voluntary euthanasia? What do they have to say and what have they done for this cause? First, we have Dr. Jack Kevorkian, a Michigan pathologist who helped those who want to die but cannot get assistance from their own doctor. Through a suicide machine. Itong nasa left picture ngayon. Yan yung suicide machine niya that is used by inserting a tube in the patient's vein where a harmless saline solution will pass through, and the patient had the option to flip the switch, sila mismo, to allow a coma-inducing drug to come through the tube, followed by a lethal drug. So in 1990, Dr. Kevorkian was contacted by Janet Adkins, who was suffering from Alzheimer's disease, to end her life. He was charged with murder, but the judge refused to allow the charge to proceed. Kasi, on the grounds that Janet Adkins had caused her own death dahil siya yung nag-flip ng switch. So, ayun. During the next 8 years, Dr. Kevorkian assisted many other people to die. But in 1998, he was convicted with second-degree homicide as he crossed the line from assisted suicide to voluntary euthanasia by giving Thomas Hugh, another patient with ALS, a lethal injection. Kasi meron siyang ALS, so he would be unable to flip the switch due to loss of muscle control. So binigyan na lang siya ng lethal injection. Doon pa lang na-convict si Dr. Jack Kevorkian. On the other hand, we have Philip Nitschke, a medical practitioner in Australia's Northern Territory, who founded Exit International, an organization that runs workshops advising people on how to end their lives reliably and safely. He also co-authored the Peaceful Pill Handbook na hawak niya ngayon nasa right picture siya, to provide the same knowledge to those who cannot attend the workshops. Ayun. Actually, many advocates of the legalization of voluntary euthanasia and physician-assisted suicide are themselves against publishing do-it-yourself guides to dying, katulad nga ng the Peaceful Pill Handbook. They argue that laws restricting aid in dying to doctors provide important safeguards. Ayun. Singer cited examples naman from the incident at the Memorial Medical Center during Hurricane Katrina in 2005, in this section of not justifying involuntary euthanasia. So, ayun. First, meron tayong example dito si Johnny Burgess, a 79-year-old patient with advanced cancer who was on a morphine drip and close to death. She was injected with morphine and another drug that slowed her breathing until she died because it would be difficult to evacuate her. Yan ang ginawa nung sa Memorial Medical Center. Another example naman is si Emmett Everett, a 61-year-old patient who had been paralyzed in an accident several years earlier and was in the hospital for surgery. Si Emmett, he had asked not to be left behind. However, it would be difficult to evacuate him kasi mabigat siya. He weighs over 100 kilos. So he was told that the lethal injection he was being given would help with the dizziness he suffered. So kahit na he asked not to be left behind, they also gave him the lethal injection, just like what they gave Johnny Burgess. Pero diniceive nila siya by saying that it would help with the dizziness. So sabi ni Singer, whether any of these killings na nangyari dun sa Memorial Medical Center during Hurricane Katrina can be justified in these circumstances is debatable. But the killing of Emmett Everett cannot be. The fact that one wishes to go on living is good evidence that their life is worth living. What better evidence could there be? So this leads us to Singer's reasons in kung saan euthanasia is only justifiable. So it is only justifiable if those killed lack the ability to consent to death, because they lack the capacity to understand the choice between their own continued existence or non-existence, or those killed have the capacity to choose between their own continued life and death and have made an informed, voluntary, and settled decision to die. Sa section naman na ito, active and passive euthanasia, Singer argues that there is another area of accepted medical practice that is not intrinsically different from the practices of physician-assisted suicide and euthanasia. Against this background, the conclusions reached may seem less shocking than they otherwise would. So, Singer cited examples from cases, pero hindi ko nababanggitin lahat. Refer na lang sa report notes or handouts for the other cases. The cases involve children like Baby Doe, who was born with Down syndrome and an improperly formed esophagus, which meant that the child did not receive nourishment by mouth. Surgery to fix the problem was offered, but the parents refused, and the hospital authorities took the matter to court. After discussing the cases, Singer argues that virtually everyone recognizes that in more severe conditions, allowing an infant to die is the only humane and ethically acceptable course to take. So, dahil dun sa realization na yun, he now asks, if it is right to allow infants to die, why is it wrong to kill them? Others have offered the acts and omissions doctrine as an explanation for this. So the doctrine holds that there is an important moral distinction between performing an act that has certain consequences and omitting to do something that has the same consequences. So, as long as one does not violate specified moral rules that place determinate moral obligations on them, they do all that morality demands of them. For example, the doctor who gives the child a lethal injection does wrong. The doctor who omits to give the child antibiotics, knowing full well that without antibiotics the child will die, does not. But Singer argues, is it reasonable to hold that the doctor who gives the injection is a murderer who deserves to go to jail, whereas the doctor who decides not to administer antibiotics is practicing good and compassionate medicine? In both cases, the outcome is the death of the patient. The doctor knows that this will be the result, and the doctor must take responsibility for their decision. Doing nothing in this situation, sabi ni Singer, is itself a deliberate choice, and one cannot escape responsibility for its consequences. Others naman propose the doctrine of double effect as justification. This holds that one action may have two effects, and as long as the directly intended effect is the beneficial one that does not violate an absolute moral rule, the action is permissible. Still, Singer argues that we cannot avoid responsibility simply by directing our intention to one effect rather than another. If we foresee both effects, we must take responsibility for all the foreseen effects of what we do. Ngayon naman, for our last section, the slippery slope from euthanasia to genocide. Some are worried that the legalization of euthanasia may eventually lead to genocide. They argue that legalizing euthanasia would be a most dangerous weapon in the hands of the state or ignorant or unscrupulous individuals. In addition, they remind that Nazis' euthanasia program started with the acceptance of the attitude that there is such a thing as life not worthy to be lived. Singer suggests that to counter this, we should do everything possible to keep our government democratic, open, and in the hands of people who would not seriously wish to kill their opponents. Furthermore, he argues that 1. The Nazis' euthanasia program was not motivated by concern for the suffering of those killed. It was never voluntary and often was involuntary rather than non-voluntary. Legalizing euthanasia. And 2, legalizing euthanasia actually acts as a check on the power of doctors because it would bring what some doctors do now on their own and in secret into the open and under the scrutiny of another doctor. And 3, there's little historical evidence to suggest that a permissive attitude towards the killing of one category of human beings leads to a breakdown of restrictions against killing other humans. So that is all for Peter Singer's Practical Ethics, Taking Live Humans. Thank you.